This is a joint one for all the heads of facilities that we selected to be part of this dialysis program and the renal units. We also have some celebrities here who are actually supporting this program in such a way that Ghanaians will understand exactly what the NHIS government perhaps is doing. So I'll start. I think the purpose of this meeting is to just give you details of what's going to happen on the 1st of December. And the fact that we are united to bring comfort to our patients, and the fact that we have thought through this carefully, and the fact that we have worked out the numbers, and we believe that the NHIS can take on this dialysis without any problem, without the scheme being the scheme having any problems. We've projected this into the future, and we know the numbers. So I'll start. In the last 6 months, we've been doing a pilot of the dialysis program of the NHIS. We started in June when children below the ages of 18 and adults above the ages of 60 were given 8 sections of dialysis for free. In between 19 to 59 were given 2 sessions for free. We had an allocation from Parliament, which was 2 million Ghana cedis. We looked at our corporate social responsibility budget and we added another 2.2 million. So the total amount that we used for the pilot was 4.2 million. And let me say that the initial submission, the initial list submitted by the Dialysis Association to us were around 700. But the numbers, the actual numbers when we did the pilot came to about 400. So what this means is that we use the 700 in our projection, but the 400 is what is the actual. So what this means is that we still have some monies left. Now, what did we do? Why do we know that the NHIS is able to take on this dialysis program from 1st of December? So we use the prevalence rates of patients suffering with dialysis in the country. We got 2 research papers. One put it at 24 patients per million population. The other put it at 38.8, which is 39 per million population. So it's a simple calculation. So if 33.3, if 24 patients is to a million population, then what is 33 million population? So it's just multiplication, and you will get about 804. So it's 33.5 by the 24 patients. So that's the minimum. Then we look at the maximum. The maximum was 39. So it's the 39 times the 33.5 million population, and you will get about 1,299. So they're within the range of 1,200. So we now look at our actual as in the 400. So the 400, Parliament has also approved 491 for the dialysis sessions as per session. So what we did was we took the 400 as in the 400 as our actual. We just multiplied that by the 491, and we multiplied it by the 8 sessions, which is 2 sessions per week. So per month you get 8. So when we do the mathematics, you get 1.5 million per month. Then we multiply that by 12, you will get about 18 million. We rounded that up to about 20 million. So what this means is that the minimum amount of money that we need to kickstart this dialysis program is 20 million. Then we looked at, what about if we open it up and the number doubles? So we looked at 800. We doubled the number, so 800. We only multiplied it by the fee that has been approved, which is the 491, by the 8 sections. You get about 3.2 million. Then you multiply the 3.2 million by 12. You get about 39.6, which is rounded up to about 40 million. So that's the second scenario. Then we looked at the third scenario, which is, what about if you open it up and 3 times the number obviously visit facilities? So 1,200 by the 491 by the 8 gives you about 4.7 million per month. If you multiply that by 12, you get about 56.4 million. So what this means is that we rounded that up to about 57 million. So annually, the NHIS will spend between 20 to 57 million to cover the 1,002 patients based on the prevalence who are on dialysis. So, as I've given you, obviously, the mathematics of it, you know, the 800 actually corresponds with, the 800 prevalence corresponds with our second modeling, and the 1,002 also corresponds with our end state modeling, which is the final modeling. So, the number of patients by our modeling on dialysis in the country will not be more than the 1,200, which is the maximum, and will not be lower than the 400, as we have indicated. What this means is that the NHIS is able to take on the cost. Now, where do we get the money to pay for these dialysis sessions? First, I've already told you that we do have about 2.2 million left over from our pilot. Our budget for 2025, as projected, is supposed to be about 8.1 billion. Normally, half of that budget goes into claims. So we will do some internal rearrangements. We will look within to see whether to reduce our administrative cost to fund it. It wouldn't be any problem, because at the end of the day, our current budget is about 6.8 billion. So to take 56 out and pay for it is something that we can do. So we also looked at the fact that the manifestos of both parties are on capping the NHI. At the moment, we are capped at about 20%. So again, it's simple mathematics. 20 over 100 times our current budget, which is 6.8 billion. That gives you about 1.3 billion extra funds coming in. And I'm stressing that 1.3 billion extra funds coming in. And if you look at the maximum, which is 57 out of the 1.3 billion, it's actually insignificant. Now, our current budget, even if we are not uncapped, because taxes are overperforming, is expected to be about 8-point-something billion. And we will cover this under our benefit package. So there shouldn't be any problem. The next leg is, what support can the NHI and the Ministry of Health give to these facilities in such a way that they are able to provide this service or these services? So, in collaboration with World Bank, the Ministry and the NHI are procuring some dialysis equipment. Currently, we ordered 30 of these equipments. 7 has been delivered, 23 of these equipment is to be cleared from the ports. It's currently at the ports. 15 additional ones have also been approved by the PPA just last Thursday. So we've set that into motion, we put it into procurement. But the good news is each 15 of these machines comes with about 2,000 consumables. So it means that with the 45 machines, we have 6,000 set of consumables. 6,000 set of consumables. Now, with this, we have just had a meeting with the heads of facilities, and we are all in agreement that it is something that we can do, and we're going to implement it to the latter in such a way that our patients will benefit from this dialysis program that we are rolling out. With this, I can confidently say that the NHI will be able to fund dialysis in this country over many years. It is sustainable on the NHI, and we are committed to improving, obviously working with the facilities to also deliver the service. Now let me give you 2 additional things that we're going to do. So what is the root cause of all these kidney diseases? So the NHI this year added preventive and promotive services to the benefit package. So currently, Ghanaians on the amount of birth are being given the opportunity to visit any health facility of their choice to check their diabetes, hypertension, that blood pressure, BMI, and weights. What this means is that we will be able to reduce the incidence of kidney diseases. We will early detect it. We will also be able to detect hypertension and diabetes early for us to treat them. The next leg is the organ donation policy. The ministry, in consultation with stakeholders, have come up with this policy. It is at the consultation stage. So that will also add on to what we are doing. So with all these approaches, it means that we do have a comprehensive plan to dealing with this dialysis situation in the country. The government is also saying that the Agenda 111 hospitals will be having renal units where modern equipment of dialysis will be put in there to support Ghanaians in such a way that people will not have to travel to Kalybos, Komfanochi, or Kumasi and Accra before they are able to have access to these dialysis sessions. So it will be available in the district. But as we are starting from the 1st of December, we now have listed some facilities across the country, and these facilities are represented here. That is why you see everyone, the heads of the renal units and the CEOs behind me, and some are also seated. So in unity, Ghana will be starting the dialysis program on 1st of December 2024 to bring comfort to our patients. Thank you.
All right, you can do it better for the CEO.
It's actually NHIS. So as long as taxes are performing, and let me at this point say that from 2016 till now, the scheme has actually grown by 6-fold. So we've expanded by 6-fold. So what this means is that we add 2 billion to our budget almost every year. And that is why I told you that our 2024 budget was 6.8 billion. It's moving to about 6.8 point something billion. Normally half of that is for claims. As we speak now, we are in November. Claims payments, the budget for the claims is still being underutilized because claims are, we paid all claims. We paid all claims, and it's amounting to about 2.something billion. So we've not even reached 3 billion. So it means we even still have more funds from our claim budget. So what this means is that we've done the modeling and we will be able to sustain it without any problem. The additional 1.3 billion that will be coming in, if you take out 57 million yearly, it's still sustainable over many years. So I think the question of sustainability should not be a problem at all. And that's why we have all these experts helping. We've done the modeling, and that is what I've actually presented to you. It is sustainable over many years. We know the prevalence as well, so there shouldn't be any problem. Yes, the promotive preventive. I think I agree with you. That is the best approach in actually reducing our cost burden. So that is why we have introduced the promotive preventive as part of our benefit package. Now, for our 20-year history, it has been curative. Curative means that you have to be sick before you go to the hospital. Now we are saying that we want to prevent the diseases. So we are introducing the annual health check, where Ghanaians are being given the opportunity to visit any health facility of their choice on their month of birth to do simple sugar, blood pressure, then body mass index. And again, we have just launched our e-health, our telehealth. So at the comfort of your home, you can now see a doctor. And education on all these are going to be intensified across the country in such a way that Ghanaians will know how to use our telehealth and to use the new innovations that we have introduced on board. So on this, we believe that on the long term, our cost burden will even come down. ECOWAS. Okay, so this scheme is for our members. It's for our members. So that is what I will say. Thank you.
Do you have any other? Yes, sir.
You see, this government is doing something wonderful, and I'm going to explain to you. You see, using digital means, especially using the Ghana card, and also with the expansion that is happening, what this means is that more people are being roped in. And our biggest problem is the informal sector when it comes to the NHIS, collection of the premiums and others. But once we are digitalizing and a lot more people are paying taxes and everything, our budget will continue to increase. So I'm even looking at a point where most of the claims are by direct payments, a direct and indirect payment, but by obviously not the premium type. But where we are able to collect it by our taxes as we are doing. So, and the premium is about less than 3% on our budget. So I think in that effect, I think we should just concentrate on how the digitalization will rope in more money for the country in such a way that the NHIS will also get what they want. Then inclusion of other diseases. Was that the question?
Yes.
Okay. So if you look at it carefully, this year or since 2017, we have actually added some complex diseases on our NHIS benefit package. And we've been able to afford it without any problem. Childhood cancer, the 4 childhood cancers. Sickle cell, recently in collaboration with Roche, Herceptin for breast cancer. So we are doing a lot. But again, Oliver will continue to ask for more. So people will continue to advocate that we add more. But we'll take it stepwise and look at it and see if obviously, we will be able to do the modeling and see which ones to add and which ones we have to obviously dialogue and add later. But at the moment, what we have is what we have modeled, and we believe that we will be able to fund this without any problem. Sarah, what was your question?
Herbal medicine, are they all captured in the benefit package? And also, how many facilities are we looking at? Have there been initial payment to the facilities, or there is a scheduled timeline?
Okay, so thank you. I mean, NHIS do not cover alternative medicine. That's it's not part of our benefit package. In terms of the facilities, for now, when we did the assessment, we do have about 40 facilities, but what we're going to do is for our QA to work hand in hand with them. That is why those 40 facilities are here. So this is why we're dialoguing. So across the country, it will be open to these facilities. But more facilities can also be added when we have credentialed them. The fact is, NHI, we do have the way we do our things. Unless we assess you and we credential you cannot be part of us. So more facilities, I believe, will apply to be part of us, and we will assess those facilities accordingly.
The initial payment. Has it been initial payment?
Has there been an initial payment? Have we already paid for?
No, we added it to our benefit package, so they know how to claim. Now the e-claim system, so once they file it monthly and we pay, so they shouldn't. But let me say that, you see, even the pilot that we did, like I told you, we still have money with the facilities. We did global budgets. We gave them a global budget to spend. So we still have money with the facilities, and the facilities are here, they will bear me out. So again, that's why I agree with the man from Delhi Guy. The NHIS is now on it. It's very solid. It's very solid. And I think for our 20-year history, it is at its best. And it's all because government is giving us the money. Because at the end of the day, in 2016, we had a debt of about 1.2 billion. As we speak, we have paid all the debt to the extent that we are begging facilities to submit claims. Just when I came here, I looked on my portal. We only have about 100 million to pay. Normally, our payment is between 150 and 200. And I have told the facilities to bring the claim so that we have money, then we pay. So it is at its best. So the NHIS is back. And I think everyone here in Ghanaian should support us, because at the end of the day, it is your support that will make us succeed or not. So thank you.
Thank you too.
Yes, sir.
And like Kalybos said, please let us not politicize this. We've been very professional on this dialysis issue. At the end of the day, dialysis do not know colors. They do not know NDC, MPP, CPP, or any of the political parties. So please help us in educating our population. Help us, because we cannot do this alone unless you, the media, helps us to achieve what we intend to do. So we thank you so much, and we thank you for coming. Thank you once again. Thank you.
Thank you.
Simply means there's hope for the future. I pray this will continue, and I also pray we don't politicize this. The politics really one, not on one side. We should buy not bet on one side. Finding a dialysis center is so difficult in certain countries. But if we are having it for our mother Ghana country, Ghana again, we should really rally behind it and help this be a milestone that we all benefit from. Not that we will also go and be diagnosed of our community, but then those we know that these facilities can help, we all help to support it. Thank you so much.
My brother has said it all. You said it. I don't like this. Yes, in fact, I love beautiful initiatives, and I think that this is one thing that will support our country, especially who are going through a lot. In terms of payment, it's very expensive. So if government has seen the need to support this thing for it to be rolling, I think that's a good thing. So I'm here to pledge my support, to do what I can to let people know about it, and also to conscientize people about how well they can take care of themselves so that it will not, they will not get to that level. So we are here to support and also to pledge that we go all out to make it well and successful. Thank you.
The first Christmas package.
Good afternoon. Good afternoon, Ghana. Good afternoon, His Excellency, and of course, the team up there, Doctor. Great work. Good afternoon, Ghana. Let me start by very quickly saying that I want to commend the good work that's happening here. And in case you may not be aware of what's happening, I'll give you a quick example. I have a big movie premiering on the 29th of November. And in order for you to attend anything like that, you need good health. Something we take for granted, you need good health. Ghana is moving forward in many ways, and we can't be left behind. There are several people who have suffered from kidney disease. People who have died for reasons that they didn't have to. And so when individuals, establishments, institutions take it into their hands to make sure that Ghana is okay, however we are going to do it, it is commendable. And to those who are already suffering from this disease, we want you to know that we are here for you. I'm encouraging you in a small way. I often said very quickly, you know, everybody says, sometimes I'm having a bad day, I'm having a bad day. There's no such thing as a bad day, because if there is, try missing one. We are all here, we're all alive, and while we all have a responsibility. In my own small way, the Chris Attoh Foundation is responsible for taking care of people and reminding the fellow Ghanaians that we are one. And so, good doctor, I would like to say right now, without taking too much of the time, that we're commending you, we're supporting you, I'm looking forward to the space and what we can also do to slowly change things and make things better in Ghana. Thank you.
Thank you. The assurance that they will do proper maintenance culture so that we don't wake up in any of the mornings or evenings to hear that, these machines that we bought are so dysfunctional that people are not even allowed to go and then have access to the facility. So we thank you all for this gesture of making the dialysis machines a reality for people to access to it. Thank you. The American United said, the son said, yeah, presenters, you don't want to be higher and offer a fatu air. Now, we call it 3 times a week. This will be needed. And this will be what you are for. It's out there, you know, a very much that burden on us will be so eased. It has been for us.
Notice that Kalybos recently inaugurated the Center for Urology and Nephrology. And that nephrology aspect has to do with kidney care. And that is exactly where we do the dialysis. And then I think Chief in his address mentioned that 30 machines have been earmarked for that. As we speak now, we have 7 of them installed, ready and then functioning. But that is not the only dialysis machine we have. We do have a cabin. I think the president of the Renal Association. We have a cabin which has about 10 to 15 machines that are also operating. So yes, we do envisage that there is going to be maybe some influx, but I think we are prepared for it. Of course, in every policy there will be teething problems, but we don't think we're going to be overall looking at what we have in place. And the 23 machines that are at the port, if they are cleared and then we add up to the pool, then we will talk about elongating the lifespan of the machine, because then you're not going to use the same machine 24/7. You will allow some of them to rest so that people will have options. I mean, not the same machine, and by so you'll be able to perform proper maintenance and be able to increase the longevity of the machine. So yes, the simple answer to that is that yes, we do envisage that there will be teething problems, of course, for every policy.
back in terms of capacity, in terms of the human resource and the rest. We certainly are ready for that. Thank you.
Piloted the free dialysis, and the piloting went well. And we have sat down with the renal unit. Once the announcement was made, we had to strategize because we knew that there was going to be an increase in the numbers, and we are ready to take on the increase. You cannot predict, but you can only model. We know that the 19 to 59 year age bracket, therefore they are actually more than the 18 and below and 60 and above. What we are also doing in confirmation that we are acquiring more machines. Recently we had a donation from the Ghanaian company. We are also getting new machines from our IGF, and we've also refurbished our dialysis center. We have another center in the family medicine unit, which can actually take 24 machines. And we are planning to equip this place. So we are ready. We are making sure that in terms of staff, we are also ensuring that the number of people that we need so that we can offer an efficient service are also on site. So we are doing rearrangements of the duty rosters to ensure that we can take in the numbers that are coming. And we are doing it in such a way that it will be sustainable. So I'll conclude by saying that after the pilot, we have gained experience and we are ready for the rollout. Thank you very much.
Welcome, sir. All right. At this point, we want to give the opportunity to colleagues from the various media houses to ask questions relating to the subject matter. Then it will be addressed. First, we will take it in fives, then we'll address them, then we'll go for the next five. If you are ready, you can show by hands as we do that, or possibly we can line up quickly, then we'll do that. We're starting. First one, your name, media house or angle you are coming from.
My name is Bernard Atuaka, coming from United Television UT.
Come from?
I am particularly interested in the sustainability of this noble thing that has happened. So,
That's a good mic.
So that is thank you.
Yes, yes, sir.
My name is Daniel Odudako from GNA. Okay, so I am particularly interested in a solution-oriented approach, where we will have to do the prevention rather than waiting for people to get into the situation before we help them. What are you putting in place to make sure that we prevent people from getting that situation, that kidney issue? Thank you very much.
Any other? Yes, sir. Just for kindly come with it. It will interfere with the microphone.
Yeah, my name is Ebenezer Kufiamponsa with the Daily Guide. Quick one to Dr. DA-Costa. If you look at the sustainability approach that you made mention of, the preventive and promotional efforts that you've already started, I'm looking at the kind of stakeholders you have here. How far have you engaged others? There are other stakeholders. I'm even looking at the schools. How widespread are you going to deal with other stakeholders to prevent people from getting the disease, or getting infected with their kidneys? Thank you.
We have another hand here.
Good afternoon. My name is Joseph Odumo. I write for the different paper. So what I'm looking at ECOWAS. What are your collaboration of the ECOWAS? Like Nigerians, and what are your collaboration of the treating our kidneys for collaboration and partnership with ECOWAS regions?
how we are collaborating with ECOWAS in treating kidney. Okay. Foreign Affairs Minister. Look, I'm going to take the first 5.